Hi everyone, in this question we have a 39-year-old woman presents with a 4-hour history of acute pleuritic chest pain and dyspnea. She has poorly controlled hypertension and type 2 diabetes. Vitals, her heart rate is 130. Blood pressure is 84 over 50. It is unchanged after 2 liters of IV fluids are given. Respiratory rate is 32. O2 sat is 90% on 2 liters of oxygen. Exam shows sinus tachycardia, normal breath sounds, and unremarkable CBC. CT angiography reveals bilateral pulmonary emboli. What is the most appropriate initial treatment? A. Intravenous thrombolysis. B. Vasopressin. C. Intravenous heparin. D. Surgical repair of the aorta. Now, let's talk about persistent systemic hypertension in the setting of pulmonary embolism. When a patient's systolic blood pressure is persistently below 90, or if there's a sudden drop in systolic blood pressure or of 40 or more, it is a big red flag. This tells us that the patient is in a life-threatening state due to hemodynamic compromise. In other words, the clot in the lung is so significant that it is preventing blood from circulating effectively, leading to a critically low blood pressure. In this scenario, the PE is classified as massive because of the severe cardiovascular impact. The initial treatment for massive PE with persistent hypertension is thrombolytic therapy using medications like alteplase or streptokinase to dissolve the clot. So the answer is going to be answer choice A, intravenous thrombolysis. And this is typically followed by intravenous heparin to prevent new clots from forming, and then a long-term anticoagulation plan. Now, what is interesting about thrombolytics in PE is that unlike stroke or heart attack, there's no strict time limit on when they can be used. Ideally, the sooner you give them, the better. But even if the hypertension has been ongoing, thrombolytics may still be an option if the patient remains unstable. However, it is crucial to first rule out contraindications to thrombolysis. And to help you guys with these, I have a mnemonic that you can use. So the mnemonic is crash ship. C is for cerebral neoplasm. R is for recent head trauma or intracranial surgery within 2 months. A is for active bleeding or recent hemorrhage. S is for surgery, major surgery within 10 days. H is for hypertension if the systolic blood pressure is above 200. S is for stroke, recent ischemic stroke or cerebrovascular accident. H for hemorrhagic stroke. I for intracranial trauma that is recent. P is for platelets being low. If the platelet count is less than 100,000, maybe reconsider giving thrombolytic therapy. So when considering thrombolytics, always check for these contraindications first because administering these medications in the wrong setting can lead to some serious complications. So the key takeaway I have written is in patients, let me move my image so you can see the key takeaway that is written. So in patients with massive PE causing persistent hypertension, the best initial treatment is thrombolysis to restore blood flow, followed by intravenous heparin to stabilize the patient. So acting quickly in these cases can make all the difference.